Fine.
Good.
Fine.
I'm good. Feeling good.
Feeling good.
Tonight, the topic we'll be talking about elevating self-esteem with personal hygiene 101. So, what does it mean by personal hygiene? Okay, so we will be sharing some tips for action. You will get a fruitful information and also facts. And for that, we are very fortunate tonight to have Dr. Nadia Elaiza. But before I proceed to talk more about our speaker, I would like to introduce myself and my team members. So, hi everyone, I am Zuhaili, or better known as Ellie. So, I am the co-host for tonight and I will be moderating the session tonight.
Hi, hello everyone, my name is Nurin. So, practically I'm going to be moderating with Ellie. And yeah, I'm going to pass it to Nur Arifa, or also known as Kak Pa. Kak Pa, are you there?
Hi guys, my name is Nur Arifa, so you guys can call me Kak Pa. I am taking care for the time queue. Thank you. Next, I will pass to Aziza.
Hi everyone, my name is Nur Azieza, but also known as Jija. So for tonight, I will be in charge for a photo session. So I hope everyone can stay until the end of this event, okay? Thank you. And I will pass to Nur Fitri.
Hi guys, my name is Nur Fitri, or you can call me Fitri, or you can call me Bae. I'll be behind the scene. So I'm with my friends here, Zuhaili, behind the scenes. So I'll pass to Ili.
Okay, hi guys, I am Zuhaili, and you all can call me Ili. But just now, our host is Ellie, but I am Ili. Okay, so I will be in charge in the text box. So if you guys have a question to ask, you guys can chat me at the chat box below. Thank you.
Okay, so apparently guys, we will have several slots tonight, which are the first one is the personal hygiene 101, followed by the commercial product versus natural product, and then we also have the personal hygiene and self-confidence, as well as the Q&A session. throughout the discussion, we have prepared some questions for our beautiful Dr. Nadia Elaiza. So we hope that everyone of us can be benefited from this talk. Goodbye.
Okay, so since we are all eager to listen to this sharing session, so I think let's get it started, shall we?
Yes, we should, Dr. Nadia. As we have heard, usually the personal hygiene are usually related to health and also helps to promoting a good grooming, right? So in your opinion, how does actually the personal hygiene is related to health?
Very simple. For instance, right now you're looking at COVID-19 pandemic. What do you do most of the time when you go here and there? You'll be washing your hands because you want to avoid from having any bacterial or virus infection. So you are actually practicing good hygiene on daily basis because you want to avoid yourself from having bacterial and virus infection. So hence, it's not just your hands, it's also your respiratory, where you breathe most of the time, when you brush your teeth, when you bathe 3 times in a day, while you wash your face 3 times in a day. So basically, that's how health correlates so much with our daily routine, our daily hygiene. So if you do not take care of your personal hygiene, you are literally having bacterial infections and viruses coming over you.
Yeah. Okay, Dr. Nadia, as you said just now, personal hygiene is very important for our health, right? But for some students like us, like me, setting aside time for each and every day for a basic personal hygiene is a challenge, especially now as we are on online distance learning. Some of us may neglect our personal hygiene since we are wrapped up with classes, assignments, meetings, and also PD talk series. Okay, so in this case, how can a student cope with their personal hygiene?
Well, to be honest, I was expecting where you're at home, your hygiene would be better than you'll be in the hostel. It should be that way. I mean, you have access to your toilet and your shower just like beside your table. So in my case, I think if you're at home, then it shouldn't be a problem. It should be very easy for you to, maintain your daily lifestyle is much easier because you don't have to travel, you don't have to take your bus, you don't have to, walk to your class, and it's not even hot in the house. I'm sure you have aircon and so on. So on my view, if you're going back to your hostel, it has to go back to your daily routine as well. If you know your class is going to be at 2, probably you need to do, some quick bathing before you go for your next class. Okay, I know it's very impossible for most of you if you're back in your hostel that you have to, go back to your hostels and get your, have your sweet own time. But clearly you have to manage your time very well. There's no other method that can fix that.
Yeah, that's right.
So I guess maybe in terms of ODL, people are not really care about their personal hygiene since they are not seeing anybody outside from the house, right? Okay.
You should. You should.
Okay, Dr. Nadia.
Right.
We are concerned, most of us are concerned with our skincare, our skin condition, right? So according to a study, like 35% of female are actually struggling with acne. Okay, acne might be coming from several reasons, right? But then it includes with the excessive usage of makeup. So what is your view on this?
Alright. Acne caused by few main factors, okay? But there are 2 factors that is actually contributing to main acne issues, which is number 1 is hormonal factor. Number 2 is because of bacterial infection. Number 3 is miscellaneous. It could be a lot of things that contribute to acne. It could be your lifestyle, which is excessive using of makeup. It could be because of your food intake. It could be because of the products that you use. But it go back to the basic, which is your hormone and your bacterial infection. So so from excessive use of makeup, is actually you're actually pulling the bacteria to your face. So there is not a saying that you cannot use your makeup. It's that you have to know how to tackle your makeup after you use it, which means double cleansing after you use it. You have to wash your blusher or maybe your beauty blender twice in a week, because those kind of things actually attract bacterial infection on your face. So I don't despise using makeup, but if you have acne issues, do not cover your acne with more makeup. You're just going to make it worse. So treat your acne. If you have acne issues, do not use makeup to camouflage it. It's definitely not going to do well for you. Okay?
Okay, but Dr. Nadia, okay, for some girls lah, right? If they have acne, they always like put makeup on their face. So, because they feel like they are not confident with their face full of acne. So, what is your advice on that?
Most of the time when I see teenagers or I see female about your age, what in their 20s, that is what they do. They come, they will put on a lot of makeup and they say because they are shy, they don't have confidence. But to me, you have to treat it. Seek a medical professional advice and treat it rather than having the issues for a long period of time, which is going to make it worse in a couple of years of time. So whenever you have acne issues which is severe, it's advisable for you to seek for a medical professional advice rather than buying a lot of products over the counter and not knowing it's going to work or not.
Okay, so we have concern on female, right? Besides female, actually male are also struggling with acne. But then male, they have like different problem of acne. Usually, 20% of male are having an acne which are longer lasting as compared to female. So, I want to know what is the reason behind this and why is this happening? Why they different experience as compared to female?
Okay, for male, okay, why is it so different with female? Because number one, hormone. Male have two major hormone which is highest compared to women, which is they have androgens and testosterone. These two particular hormones actually secrete more oral sebum production, which can cause more clogging. Okay, and number two, generally male do not care of skincare routine. So hence why they do have this longer period of time, and most of them will only start to take care of their skin after someone have said, what's wrong with you? That's what I've actually noticed. Hence that's why male don't really have issues as women. That's why female technically have a better overview about skin, but not male.
What's wrong with you, Kamaru? We have to say to him, what's wrong with you, Kamaru? So then he will take better care of his skin.
They don't really have, I'm sure, most male, or I think guys, we don't have even a pinch of cleanser. They sometimes use bath bombs.
Right.
Anything that can be reached.
Anything.
Yeah, they use liquid detergent also.
Okay, Dr. Nadia, despite people who have acne issues like male and female who have any issues, a basic skincare routine is a must for everyone. Okay, we know that. But when can someone actually start to have a skincare routine? And can you share what are the basic skincare that we should start and practice? The basic one.
Okay, to be honest, if you have your siblings or younger siblings, they should start as early as 12 years old because that's where the puberty starts. Yes. So they will start having all these small bumps all over their face, this folliculitis they call it. So to practice to have a very healthy skin, you have to start from young so that you don't have this problem when you're 17 or 18, because at the point when you are 17 or 18, you'll be like, why do I need to use this now? If you nurture it at a very young age, it's be much easier. So the basic skincare routine is actually very simple. You have to go back to your issues, okay? You can just have a basic three, which is a cleanser, toner, and a moisturizer. I know boys don't really know what is toner, what is moisturizer. At least have a cleanser, and it's fine. So, but nowadays, because we do have UV rays coming, so we tend to have pigmentations as well. So sunblock is a must as well, regardless for male or female. You're going to thank me for telling you this in 10 years time.
Basically, it's not just male that don't know that toner and everything is important, but some female also not concerned about it. Okay, like you said just now, sunscreen is important. Okay, there's a research say that we have to wear our sunscreen 2 fingers. Is that true?
Actually, I would say as 2 finger breadth.
Yeah.
Or 2 fingertip unit.
Yeah.
Just as a coverage for your entire face. But that's just a saying by studies. But be mindful because they actually did a study for a Caucasian face. Asian actually have more melanin. You have to use more. Okay, so just use more. It's okay.
Okay, what about skin type? So like we know that different skin type we have different products. So how do we know our skin type?
How do you know your skin type? Okay, basically you have only 3 different types. You have dry, oily, combination. Okay, touch your nose from here up to this level. If you feel that this part is oily, okay, and the entire part until the back of your cheek is oily, then you have oily skin. If you have this part only that you feel that is very, very oily, but the cheek side is very dry, then you have combination. Technically, if you have the entire face feels dry, then you have a dry skin.
Okay, so when is the best time to check? I mean, after we wake up from sleep or before we sleep?
When you wake up.
Okay, when we wake up. Okay, I just know that, so I'm gonna check what's my skin type.
Sometimes it's not the skin type as well. It's when you're going to have that kind of issues. Sometimes, when you're about to have your menses, you're going to have a very high oil sebum production involved. And most of the time when you have your menses coming, you will have acne. Definitely, most of you. Why? Because you have higher oil sebum production at that point of time. So when you know that that's coming, you have to have a specific kind of facial foam to cater the higher oil sebum production. So it's not necessarily every day you have the same skin type. It depends on the lifestyle as well. Sometimes when you tend to take more nuts or dairy, it actually gives a lot of oil sebum production as well. So at that point of time, you have a lot of oils. So technically, you have to understand when and when.
I got it. Thanks so much.
So basically, the diet also plays important roles.
Yes, acne, diet. So that's the reason why you cannot take chocolate. Some people, it's not that we cannot take chocolate, but some people when they take chocolates, they take sugary stuff. So it actually induces your happy hormones. So these happy hormones are called androgens. So androgens makes you feel happy, and it actually releases a lot of oils on your face.
I see.
And you will have acne. But technically, it's not everyone. But there's a study proven that way that you will have happy hormones increase. That's why that when you eat chocolates, you're happy. Happy, right? Sugar.
Yeah.
Sugar, you're happy.
Now I know this.
You take all your sugar and your chocolates. So that's that.
What about coffee, Dr. Nadia? Because some say that if we drink too much coffee, too much caffeine, it tend to make our face become acne. I mean, become worse.
So basically, caffeine actually induces your melatonin, which makes you don't sleep. You have more energy. When you have more energy, it also increases androgens. Increase androgens, increase oil sebum. Okay, so it's okay to take coffee. It's okay to take chocolates. It's okay to take sugar, but not excessively.
Moderately.
Moderately.
Okay, but somehow.
So you guys should give me chocolates before you consult me.
Yeah. So be happy.
So I won't be so angry,
To be happy all the time. Okay, Lorraine?
Can I ask a question, Dr. Nadia?
Yes.
Okay, this is regarding skin juga, but I believe there is a strong connection between our hair care, the conditions of our skin. So perhaps you could explain a little bit, because it seems like some people, they jaga their skin, facial skin very well, but they jarang basuh their hair. So somehow I feel it's connected. Sometimes when the hair is oily, the face skin tends to be oily as well.
Yes,
so maybe you could explain the connection of it.
Yeah, of course. The face, the body actually releases oil sebum production, like I was mentioning just now, equally. Any part. Is just that the difference is the skin level. Okay? On our face, the thickness of the skin is different than the thickness of our scalp, as compared to our hands and our body as well. So that's why the first thing that you will notice, why is it here? First, because you look at it most of the time. But your scalp, even your body, are actually producing the same oil sebum production as well. So a lot of people do not take care of their hair, because that's not technically what they see as the first thing first. But to be honest, if you have oily face, you do have oily scalp.
Right. Right.
Okay?
Okay, since we're talking about hair, right? Okay.
Yeah.
I wanted to ask in a perspective of hijabis, okay, people who wear hijab. Okay, basically hijabis will have their concern which is being addressed, scalp, the split ends, and then the hair loss problems and few other things that they are concerned. So may I ask you, what lead to this problem and how can we prevent it from happening? Is it because we really wear hijab?
Okay. Before I proceed, why hijab actually caused the hair loss? Okay, I will actually explain why do you have hair loss. So hair loss caused by few factors. It could be because of hormonal, it could be because of lifestyle, it could be of food intake as well, and it could be the third one. It could be because of medical condition. Okay. So sometimes you do not know which one that you have. But since we're talking about personal hygienes, why do you notice that when you wear hijab, you will have hair odor, you will have hair fall? Okay, so practically because it's a very closed area, which a lot of us do not take care of. Okay, imagine a bacterial infection is stuck underneath the hair. After we are, on daily basis, you are doing your daily routine, you're having not just your oil sebum production stuck underneath, but you do have all your sweats all over. Okay, so this contributes to hair fall, to be honest, because of the clogging of the oil inside the pores of the hair. Okay, at the very edge of the hair. So what you need to do is, if you have hair falls, of course you need to intervene with some special shampoos that will help in accelerating with hair falls. So technically, why hijabis tend to have accelerating hair as well, if you notice, some of us may have, okay, because of the pulling of the hair towards behind. We call it as a traction hair loss. Okay, which means whenever you wear your inner shawl, inner tudung, kan? So then they pull ke belakang sebab terlalu ketat, so it will cause a traction of hair fall. So that's why by then you will notice your hair is at this part. It's not because of hair loss, but technically it's because of the traction or fraction that you did on daily basis. That is number one. Okay. Number two is you also have to wash your inner shawl. Most of my patients that I asked, sometimes as a student as well, you don't really wash your inner shawl. It's only the outer shawl that you wash. You may wash probably about once a week. Okay, I do notice this. So this hygiene has to change, because imagine that bacteria is already sticking up on your inner shawl for days and you keep on wearing it. Imagine how many bacteria you're actually invading on top of your hair, despite having to wash your hair every day, but you're putting back the bacteria on top.
Yeah.
Right? Okay, so I'm sure most of you are facing this as well. So you need to change that habit. It goes back to your personal hygiene.
Okay, so Dr. Nadia, in regard to hair and skin problem, is it possible for people to just stick to natural skincare regime to recover, or is there any condition where they have to seek for a dermatologist like you, dermatologist advice? So is it when they are already bald?
Of course, you won't come to me when they're already bored. The moment they see some issues, they come to me. Okay. So to me, it's very simple. If it's severe, if it happens already about 3 months and there's no solution, there's no point keeping up to yourself. There's no point spending so much over the counter and not knowing what works. Again, I'm trying to repeat this. Seek for the medical advice, so you don't have to worry a lot of things, and at the same time you get to rectify your issues. Okay, it doesn't matter in regards to natural remedies or even chemical remedies. Okay, it depends on what issues do you have, because I'm not against on any natural remedies, I'm not against any chemical remedies. There are no do's and don'ts, there are no yes or no, but it goes back to your issues.
But hair is also have a hair type, like the scalp is oily or dry or what. So how do we know that?
Most of the time, the scalp is oily. It will be dry if you have some medical condition, like eczema, or probably about a bit of psoriasis. Rarely the scalp is dry. Very rare, because we have a lot of hair follicles. From the hair follicles actually induce a lot of oil sebum. On top of that, the hair scalp, our scalp is actually very thin, hence the oil sebum production goes out even more. And because we enclose this part, hence that's why it became more moist. So rarely the scalp gets very dry unless you have some certain medical condition.
Okay, Dr. Nadia, sorry I tanya. I don't know if everyone, the participant ke, or even Dr. Nadia is aware of this YouTube or IG on pimple popper. I'm a big fan of that. I love watching like how these doctors...
Satisfying.
Yes, it's so satisfying when she press that thing, the keluar. So apparently after watching several of it, I'm a big fan of that. I noticed there are differences between like just a regular pimple and something that we call cyst. Okay? So cyst ni can actually appear on every part of our body, every part of our body. Sometimes I feel like macam pelik-pelik, the parts that I saw they took out the cyst. So does this reflect the way a person care for their hygiene, ataupun it's, you know, like if we're not care enough about our kebersihan, or is it like our gene kan, kita punya just internal that we don't know of? Because sometimes it is in parts yang macam kita tak nampak, you know, like those parts, especially on the back kan, the back we cannot see, and of course we cannot reach that all the time. When we mandi, we want to wash that part betul-betul clean, we cannot really reach them. So maybe you could explain a little bit about that. And I'm sure at some point and on any parts of my body I have that thing, you know. So I don't know, I mean you don't feel the pain sometimes, you know, maybe up to a certain time.
So sebaceous cysts, or there's a few type of cysts actually, okay, which one that actually caused to which is different as well. But most of the time cysts are caused by having high number of production of oil, okay, on that very particular pores. But because it's infiltrated also with bacteria, it's infiltrated as well with your hormones, it double ups the size. So sometimes it's not really because of you are not taking care of yourself, which is a personal hygiene, but because some of the part of the body that you cannot reach, that it may clog the pores, okay? And add up to you yourself having high oil production in the body. So a lot of people who has this issue with cysts are male rather than female, because their pores is even bigger and they tend not to take care of themselves as much as women.
Okay, Dr. Nadia, if they have like that kind of problem, is there any body wash that is being recommended that there's an ingredient that they can use?
For cysts, definitely you have to undergo intervention with a surgical procedure. Having a cyst. If you're not having a cyst, if you're just having a body acne, you're having folliculitis, you can actually find a body wash, which is, you can use any Cetaphil body wash or anything that contains pH 5.5 that caters for body acne issues. You can actually reduce the oil sebum production on the surface, not too internally, but on the surface. But if you have severe body acne per se, it involves until the whole trunk, okay, you may need to be intervened with antibiotics and some other medication to control the oil. It may not be sufficient to just use the body wash.
See. So, Ali, do you have any questions regarding the body?
I have.
Yeah. I have.
Okay, I think enough about the facial skin and all that. I think one of our major concern, I think all of us are adult, is our private area juga. Our private area ni, there are advice lah. Kadang-kadang orang kata do not use apa dia panggil tu, feminine wash and all that is going to make it even worse or something. Just wash with water. But honestly, we cannot really see how it looks like, you know. But when we see on those YouTube and all that, kadang-kadang kita ada tengok like some of the skin color is not exactly the same tone as our regular skin color kan. It's a little bit darker on that side. So how do we what kind of product should we use then? Because we are not advised to use feminine wash. So we are only advised to clean it with water. And how clean can we be clean to be clean?
Okay, so basically feminine wash is a different thing than if you're talking about lightening the area. A lot of people were thinking about lightening the area. So feminine wash is actually advisable to use, to be honest. Why some people do not want to use it? Because they were thinking, because to be honest, we all have a microflora on our body. Why we use the feminine wash is to ensure that the pH of the microflora remains the same. So there comes the feminine wash to actually balance out the pH level. So that's the function of feminine wash. But if you were to go for feminine wash, do not go for the ones that actually sell. I'm not too sure lah, but a lot of people do jual dekat public, but there's no KKM approved. Okay, so you have to go under the drugstore because there are certain studies that they have done. It's not simply just any kind of product you can just wash using the feminine wash. Tak boleh just mix and match. Okay, find something that is reputable, that is already inside the pharmacy, then it can be used. For the color for that area you were mentioning, why is it different? Okay, to be honest, actually Asians have a different color compared to Caucasians, Chinese, okay? Because technically we wash using water. Okay, so that area actually dia jadi lembab. Bila jadi lembab, dia akan jadi lebih gelap. Okay, because it's a closure area. That's why you notice only Asians has this coloration. But how
advisable to put on bedak or powder at some point because you mentioned lembab kan? So is it advisable to make it dry instead we put that?
No, just dry it with normal towel.
Okay.
Because if you put bedak kat situ, it may actually cause clogging dekat bahagian vagina. You may change the pH. Kita takut benda tu je lah.
Okay.
You may not want to put anything down there. That's why with babies as well, last time they practice to put a lot of bedak dekat bawah tu.
Right.
Actually, you shouldn't. Yeah. It's not advisable. It shouldn't. So to those of you who are about to have babies in future, do not do that.
Actually, we can use a feminine hygiene, right?
Boleh?
Also. But what if the feminine hygiene yang ada fragrance tu? Yang ada bau-bau wangi?
I always advise to take the ones without fragrance.
Like lactacid tu boleh kan?
Yes, boleh. Lactacid is good. It's a good brand. It's been there for quite some time and it has proven clinical studies as well to use.
Right.
So if you were to choose between which and which, go for the one that has less fragrance. Because why? Fragrance sometimes do have a bit of substance that it may not be suitable for you.
So we've covered on the feminine wash sini. But there's one question here, which is most of our environment really concerned on it, but then we doesn't really mention it publicly because it is quite it is related to the self-esteem problem and so whatnot. So actually it is about the body odor problem. Okay, so we know that the body odor problem may be because of the excessive sweat and maybe genetic, and crucial for us to use the antiperspirant or deodorant in our personal hygiene routine in overcoming the unpleasant body odor.
Okay, first of all, of course, excessive sweating will cause you to have body odor. Indirectly, definitely you will have that. Okay, what causes excessive body odor? What causes excessive sweating? Of course, your lifestyle, because how do you work? Stress induced sometimes. It goes back to your hormone once again. Okay, of course, you need to use antiperspirant and deodorant to reduce the chance of having body odor and also excessive sweating. Okay, but there is a medical condition, axillary hyperhidrosis, which with or without the condition you are stressed or not even working, you're just staying in the room, which is a very good condition, but you still have excessive sweat, then that one needs to be intervened by a medical condition, by a medical medication. So you need to know. If you don't have that, of course, when you have excessive sweating or body odor, you need to use deodorant to protect yourself from having any smell that you don't like. But if you are the ones that actually have problem with axillary hyperhidrosis, which most men has this, they have to actually seek for medical condition, because they will start to have all this wet punya ni kat sini kan, and then whatever they use pun tak sampai 1 jam je dah berpeluh dah. So it's a medical condition that needs to be treated.
So what actually causes BO? Is it the things that we eat or
The diet.
yeah? Is it the
It's the
food?
diet. It's the food. You are what you eat. So you eat well.
Like what kind of food that are actually contributing to body odor?
Okay, there could be a lot actually, but especially those that contain oil and fats.
Oh,
Oil and fats. Got it. Okay, what's your thought on people that do not wear deodorant or antiperspirant?
I don't believe in judging. I don't judge. Maybe
But how do we tell someone they have a BO?
Oh,
Yeah.
how do you
It's
tell?
really
What do
hard.
I tell? You tell them that you have a body odor.
I find it really hard. I mean, we don't want to offend anyone, but
that's right.
It's very hard to actually tell them, right? They practically have actually breathed the same thing daily basis. So maybe you could give a gift.
yeah, I was about to say that. Maybe we should give them a present for their birthday, like 10 bottles of,
Antiperspirant.
antiperspirant. Yeah?
Dr. Nadia, okay, some people don't wear deodorant or antiperspirant, but they always ambil limau and then gosok-gosok, kai mandi.
No, don't do that.
Don't do that. Okay,
Really?
why? Yeah, some
I think
people
most
do
of the
that.
people are saying that.
It's good.
Ah.
Technically, what you're doing is exfoliating.
Yeah.
Okay? If you're doing that to lightening up, then it's fine. But if you're doing that to reduce excessive sweat or body odor, it doesn't help.
Oh, I should do that. Okay. I don't do
You're
that.
not you're not actually stopping the oil sebum or even the smell. You're technically just lightening up because it's an acid. Lemon is an acid, so it actually helps to exfoliate. So a lot of people do that because they want to lighten up that area. Technically, it's not to reduce the body odor.
Reduce the body odor.
Yeah.
I got it. Okay, so Dr. Nadia, we have covered skin, we have covered hair, body and all. So there's a claim state that a good personal hygiene is very important in today's society, especially for social reasons. So how does personal hygiene care relates to personal confidence?
I'm sure you know. If you have a good skin, would you be happy?
No.
Yes, of course.
Yeah. Even after you bathe, okay, just from your toilet, you just have a good bath, you just have a nice hair, shampoo, then you just come out from your toilet. Would you be happy? You're like, you just come out from your toilet. Would you be happy? You're like, I'm confident, despite not seeing anyone, but you just feel good. So technically, if you have a good skin, you have a good body, you have a good condition, technically you're confident.
So I also realize that people who have a good personal hygiene, they didn't really have to be afraid of macam kalau tiba-tiba orang datang rumah dia macam okay je.
Dah rumah dia, okay.
But then kalau orang yang ada that kind of problem, that personal hygiene, they are less practice their personal hygiene, that it will be a problem for them because they are confronting people, I think.
Yeah, because they don't take care of what they should take care of. So whenever people come, especially, it's not just personal hygiene, your personal space. From the space itself, you know how hygienic that person is. You don't only take care of their room. If their room is as bad as it can be, you know how hygienic they can be. So yeah, so unhygienic people you can actually see from not just from the outer view, but from their rooms as well. I'm sure.
I think from their nail also.
Yes, from the nails. Okay, so a lot we can talk about from the nails, from your teeth, from your face, from the hair. But sometimes acne, you cannot judge them for not being hygienic. Okay, that's something that you have to ensure. Don't judge someone. Oh, he has acne. He doesn't take care of his skin. He doesn't have a good hygiene. Not necessarily. That one you have to think back. Okay.
Yeah.
Because technically, sometimes acne issues because of hormones, something that you cannot, control it.
Okay. So, Ellie?
So maybe we can open the floor. I think it's about time we can ask questions.
Yes, yeah, we can proceed to open the question.
It seems like a lot of people is actually trying to ask question ni. Ramai yang berminat dan ramai yang buka kamera ni.
Hi. I'm sorry, I'm at the public. So I just wanted to ask because I have like sebaceous filament under at dagu, under the lips, and I want to know what is the cause of the sebaceous filament and what product best to treat the sebaceous filament. Thank you.
Alright. Hello Naswa, thank you for your questions. First of all, how do you know that it's actually a sebaceous filament? So it's very crucial for you to know. Sometimes you may miss out that it could be just a folliculitis. Normally under the lips, it wouldn't be a sebaceous filament, it could be just a folliculitis. So what you need to start doing first is to find a product that has salicylic acid that could actually exfoliate this part of the face. If it doesn't improve by time, you may need some surgical intervention to be removed slightly down there. Okay?
Alright, thank you.
Right.
How do you get rid of strawberry skin? Macam any lotion ke or
After you shave, do you mean?
even now pun dia macam strawberry skin juga dia punya leg punya sorry.
Listen, okay, actually when you are shaving, it's actually not advisable to shave until to the skin. Okay? What it will happen, actually the hair will actually start underneath the superficial skin whenever there's a new skin coming up. So that can cause friction. So when it causes friction, that can cause damage. So you will start to have this red color thing, macam merah-merah, that it causes strawberry skin. Okay? Because of the hair is trying to go out but there's no space. So they can start to crawl underneath the skin instead of going out from the follicle itself. So the key is, if ever you are deciding which one you want to do, if you want to shave or you want to what is the other thing that the people do, waxing. If you're choosing between two, go for waxing, because waxing they will actually pull out until the very edge of the hair follicle. If you're shaving, it's only up until the surface, so they will left a bit of hair follicle down there. So when the hair follicle wanted to grow, they cannot go out because of the skin on top. Okay, so it's good to do IPL laser. Yeah, nowadays we have IPL laser, so it will die off the follicle straight away, and it will not cause any harm to your skin. So a lot of people divert to do IPL laser because it's permanent, and you don't have to shave your leg most of the time. You don't have to shave your leg at all. Sorry, at all.
Wow,
interesting.
There you go.
Yeah. So it settles your issue.
Okay, is there any questions?
Is it because is it sebab memang saya tak sesuai untuk pakai the family wash at all, ataupun saya kena cuba je semua brand yang ada dekat market tu pasal family wash?
Okay, actually because your skin is a bit sensitive, that probably the acid is not suitable for your skin kat situ. Okay, the ones that in drugstores are actually kenapa kata tak sesuai, sebab most of the time dia sama. They do it for general punya condition. It's not specifically for your skin, maksudnya, or specifically for you. So that's why it's not advisable for you to try sebab banyak-banyak yang lain pun. If you have issues with family wash, tak semesti you kena guna family wash. It's just you have to do more cuci lah. Dia bukannya compulsory. Family wash is not a must. That is good for maintaining pH level. Tapi kalau kulit you tak boleh tahan dengan acid of the family wash, then it's not advisable for you to do lah. So nanti gatal dan sebagainya lah. Okay, because technically with family wash dia pukul rata. Maksudnya for any kind of skin, there's no family wash yang kata untuk kulit sensitif. There's no family wash saying that, if you notice as of now. Semua dia sama sahaja. If for skincare ada, because normally down there we don't really care about the dry ke atau dia lembab ke. All we want to do with the family wash is just to ensure to maintain the pH level. Tu je. So if ever you have issues with any discharge yang tak berapa yang alarming, that one you need to seek for gynecologist punya second opinion. If you don't, then it's okay. Not to wear pun okay. It's not a must, but if you have it, boleh. Okay?
Okay, so we have another question from Siti Hajar.
Hi, Dr. Nadia. So I want to ask regarding the sunscreen. Since we stay at home, right? So is it necessary to apply sunscreen and to reapply the sunscreen and at day? And also, is it necessary to apply at night also? Since I heard they say since we're exposed to the light from our laptop, from our phone, so yeah, that's my question.
Alright, okay. So with sunscreen, it's actually it's very easy. Okay, why we use sunscreen is because kita nak avoid from 2 UV rays. Actually, we have more UV rays, but yang paling essential is dua, UVA and UVB. So UVA will cause to have wrinkles, dryness, aging. Okay, B, just remember B means burn. So it will make your skin from dull and dark. Okay, so UVA, why you were asking me why you have to wear it? Dalam rumah kena pakai atau tidak? Dalam rumah still have to wear, especially if you have windows, because UVA rays can penetrate through the windows. It's very strong. That's why inside the house you have to wear it. Why do you have to reapply? It depends back to your SPF level. As if you notice, if you look through your sunscreen, ada SPF 50 dan juga PA+++, if you notice that. Okay, so SPF means sun protection factor. Dia tulis ada yang 35, ada yang 50, correct? Okay, so 35 and 50, it actually a calculation of how many hours it covers. So if it written there SPF 30 means the coverage is about 2 to 3 hours. If SPF 50, the coverage is between 4 to 5 hours. Hence, that's why you need to reapply after a certain hours. Okay, that's why I always advise if you want to find sunscreen, go for the ones yang ada 50 because it will help you in your daily routine. You don't have to reapply too frequent. Okay, so and then you were asking me, should I wear sunscreen at night because of the lights? Okay, of course, there is a UV fluorescent because of kita punya lampu. Tapi technically it's very thin. It wouldn't cost so much to your pigments or your aging. So malam tak perlu pakai. Okay, just reapply in the morning up until petang. So if it's 5 hours, I always advise my patient, if you're taking the SPF 50, ensure use it at pukul 8, and then the next one at 12, and the next one at 4. So you just know. Okay, when you do the application of sunscreen. Okay.
Thank you. Okay, Fatimi.
Saya ada 2 soalan, tapi tak tahulah kalau saya terlepas train ke apa. Okay, soalan pertama saya, kan tapi most of us kan ada masalah blackhead dengan whitehead kan. Are we allowed untuk picit benda tu, keluarkan? Sebab rasa betul satisfying. Kadang-kadang kan, dia kalau kita picit pun rasa soft tau kulit, macam licin. Serius. Lepas tu second, kan ada some of us juga, macam it's not me, tapi ada yang masalah yang pori dia terbuka. It's not only dekat bawah, tapi saya perasan lah ada certain orang yang dekat pipi pun ada nampak putih-putih tau. Dia punya pori tu terbuka dan dia terkeluar tau, benda putih tu. So, what do you advise about that problem? Thank you.
Alright, so basically your issues is about whiteheads and blackheads. Alright, okay. So technically the conversion of going to acne it actually begins at whiteheads. Okay, they start jadi whiteheads. The oil sebel will actually try to go up from your skin, and then dia akan jadi, mula bila dia dah cluttered underneath your skin, dia akan jadi whiteheads. So the moment dia boleh keluar sikit, dia terkeluar sikit from your pores, dia akan jadi blackheads. Why it became blackheads? Because dia dah teroxidized. Okay, and then eventually bila dia dah lama sangat dekat situ, and dia akan combine with your skin dead cells, it will become comedonal acne. Still not infected yet. The moment when your skin pH changes because of oil sebel production, then it will attract a bacterial infection yang stays around your environment. Hence, dia akan jadi purpurium acne, which is the acne yang besar-besar tu lah. So you were asking how you supposed to control your whiteheads kan? Okay, of course lah. Everyone wants to, pick and pecahkan your acne. Even if you have acne, not just whiteheads or blackheads. Whiteheads, blackheads pun memang a lot of people likes to do, but most of the time people like to pinch your acne. But it's not advisable to do. Why? Because it can cause scarring. Okay, so kalau you're okay to have a scar, post-scar because of you actually poke your acne or your whiteheads, then it's okay. But I always advise don't do by your own. Okay, so how do you want to reduce whitehead and blackheads? You need to find a good chemical exfoliator. Chemical exfoliator can come from your cleanser. So those yang ada AHA and BHA, okay, which is if you can find kat belakang tu ada glycolic acid or salicylic acid, will be a very good product to use to exfoliate the whiteheads and blackheads. Okay, so do not pinch by your own to avoid scarring and more bacterial infection lah, sebab tangan kita actually filled with a lot of bacteria. So when we do our own, actually we are actually not fixing the problem, we're actually adding more to the problem.
I cannot help but notice your great skin, Dr. Nadia. You have such a beautiful skin. So perhaps you can share with us what product are you using? Kan, very useful kan. So maybe I guess I miss that useful skin lah. So maybe you can share with us.
Wondering too, Dr. Nadia.
Kan.
It's already beautiful.
I think it is the camera, maybe.
Well, I guess as an aesthetic practitioner, of course you need to show a good example kan. So I'm sure you actually, orang kata, do what you preach kan. So how do you like, maybe just tell us what product lah, so I can go tomorrow, you know.
Well, okay, to be honest, of course I do treatments in my clinic as well, so that to maintain it doesn't take to ensure you have a good skin. It's not just through your skincare. That is definitely one thing that you have to understand. It has to do a lot with cleansing up your face through some in-clinic treatments as well. Whereby nowadays we have a lot of ways to do with it. Okay, so let's say if you're talking about you're having whiteheads ke, blackheads ke, kan, acne ke, a lot of people actually dulu buat facial. Nowadays people are not going to do facials anymore. If you have heard, people do a lot of chemical peeling. Chemical peeling is actually very excessive things that we do to exfoliate the dead skin cells to ensure your skin is as healthy as possible. So one time of chemical peeling is as good as 10 times of facials. So a lot of people will be doing that. Products, of course, it helps a lot, but you have to understand what kind of things that you need for your skin. So if you're acne prone, if you are acne or oily prone, you have to find a product that actually can control your oil. If you're looking for anti-aging products, if you want to anti-age yourself, you have to find an anti-aging products, which is especially it goes by the serum. Sebenarnya the cleanser, kalau for anti-aging, actually for cleanser, toner and moisturizer, you can just use anything. But your serum, you have to be specific. If you're looking for something to anti-aging yourself like wrinkles or lines, you can use retinol. But a lot of youngsters nowadays dah pandai dengan products, I'm sure, because I have a lot of my patients yang about 25 years old, 24 years old, about your age, coming to my clinic, dia bawa the whole stack of dia punya serum atas meja. But,
yes, that's about my age, yes.
Oh, okay. They were like bringing all this product and put on my table, and I was shocked because they have all types of products. But the thing is, you have to know what you are treating, what you want to treat. You cannot be using vitamin C juga, kojic acid as well, retinol as well at the same time. You cannot layer them together. I don't believe in layering, but you can use in different time. Let's say in the morning you want something to brighten up your skin, you can use something that contain vitamin C. Tengah
If I
hari,
go to your clinic, can I get that skin?
can. I will try as best. I don't think your skin is a problem, Madam Azrin. It looks good from here.
Hello everyone, and good evening to Madam Azrin and Dr. Nadia. So I would like to ask, actually, especially women, we tend to wear makeup just to cover our flaws, right?
Yes.
So, I know makeup contains chemicals, but somehow, like me, I don't really like to put makeup, but I have to put because I have acne. So, is it helpful if I just wear makeup every day, but at the same time, I still struggling to find a good product to get a better skin? So, doctor, do you have any opinion regarding makeup?
Okay, as I was mentioning just now, I told you that there's nothing wrong to use makeup. But if ever you have issues with your skin, which is severe, or it has been there for quite some time, it's advisable for you to seek for a medical advice to treat your acne, rather than you spend, a lot of money over products you're not sure of whether it's gonna fix your issues. So I also despise the fact that you keep on using makeup all the time to cover your acne, and your acne keeps coming.
Yes.
And it keeps coming. So the problem is not solved. It's okay to spare a bit of time without makeup, but you are able to get back your healthy skin. And then after that, if you still want to use makeup, it's okay. You can use your makeup, but your aftercare after using a makeup has to be very strict, which means double cleansing. Wash your beauty blenders, wash your blusher. You have to wash that, because the problem is when you have acne as well, you're not helping yourself. You're just making things worse.
Yes. I nak tanya macam nak treat dark circle dengan eye bag And also one more question, kita ada macam bibir kalau tak pakai lipstick kan macam hitam kan, macam nak treat bibir supaya dia tak nampak hitam. Okay, that's all. Thank you.
So if you have under eye issues, it could be a lot of cause that cause to have under eye issues. It could be because genetical factor, it could be because of your hormone, it could be because of your lifestyle as well. So these three things, if you have it, we have to identify first to assess. Any type of products that you use for your under eye, it won't work. Okay, because technically it causes by these three main factors: genetical factors, hormones, and also your lifestyle. So probably you can change a bit of your lifestyle, but if your genetical factor memang menyebabkan you ada huge periorbital, so you have this darkening because of aging process, so you cannot fix it using any kind of products. There's nothing over the counter that can help it. So you need to do some in-clinic interventions to help it, to help your issues. Okay. Second question tadi you were asking about bibir gelap kan? Okay. Bibir gelap can be a lot of issues as well. It could be depending on your hormone, your lifestyle as well. Because some people, because they smoke or they tend to use lipsticks that are actually very tinted, okay, that actually cause more darkening sebenarnya to the lip. So you can try exfoliating first with a scrub for a couple of weeks. If it doesn't wear off, then you might need a laser to actually brighten it up.
Okay, talking about that lips kan sekarang dia ada treatment yang apa kan dia panggil dekat some of this beauty place ni, dia buat apa entah, dia macam like a tattoo thing, you know.
Yeah, dia buat lip tint.
Lip tint, yeah. So is that advisable?
No, because what they do is actually they are putting a colour underneath your skin. There's a layer on top of the skin, we have another layer, dia taruh bawah tu. So probably tak sah semayang in one thing. Secondly,
right,
it will cause your skin to be like that for quite some time. Tak even the colour will be not even by time.
Right. So you mean to say it's much better to do laser eh?
Yes, yeah, much better to do laser than a lip tint.
Because I think some of us this maybe not because of lifestyle, tapi dia memang ada dark.
Yes, because of that genetical factor sometimes. Memang
genetical, yeah.
So
for that we can also do laser.
Yes, you can do lasers. Okay. It's safer and the results is actually quite optimized juga.
Just want to ask one question. According to you, Dr. Nadia, is it true that when we frequently do facial treatment using machine, dia boleh menyebabkan kulit kita jadi nipis? Betul ke?
What do you mean by frequently? How frequent do you do?
No, okay, actually I just buy this one. Dia untuk skin lah, macam untuk bersihkan lah. Tapi orang cakap
tak for you?
Yes. Tapi orang cakap tak elok. Katanya nanti boleh keringkan, boleh nipiskan kulit. Lepas nanti seri-seri pun hilang. I don't know which one tu. Mana tu? Mitos apa yang sampai? Tu yang nak tanya.
No, Foreo is actually very very mild. It's very mild. It's a very mild exfoliation, so it wouldn't cause so much of skin tint it wouldn't reduce so much on your skin punya what you call it, just skin thickness lah. Tak sangat sebab it's a home routine. So anything your home routine should be no issues unless you're doing a peeling process on weekly basis. Peeling process usually you don't do at home. Usually it's only a clinic basis you boleh buat unless memang I don't know how you get that products lah. But peeling process has to be done only in clinic. You can only do it twice in a week. Terus kalau you tu lebih
Twice in a week?
Twice in a week. Sorry, once a fortnight.
Okay, once a fortnight. Okay. Once every 2 weeks lah.
Yeah, once every 2 weeks. But that is only for those who have severe acne atau they have some issues. Then we do more frequent. If you don't have issues, usually once a month. That one can cause a bit of problem with skin thinning lah. kalau betul nak cakap pasal kulit nipis. But Foreo doesn't do that. No issues. Just do use your Foreo as per usual. Tak ada masalah. Foreo is a home device. It's very safe. It's actually to help more in cleansing your pores. Dia tak cause peeling.
But okay guys, do you remember we mentioned about a mystery gift in our posters and our Telegram blast, and also before we start our talk. So now this is the time. So in order for you to win this mystery gift, you need to answer one question that will be given by Dr. Nadia. So this opportunity will be open to all. So are you ready? Okay guys, please answer because you will get the best prize lah.
I am ready.
So the question is actually related to whatever that I talked about from an hour ago. So if you guys pay attention, you can actually answer this. It's actually very simple questions. So what are the causes of acne? 3 causes of acne. Can you let me know? Can anyone tell me what are the 3 causes of acne?
Hormone, hygiene, and what you eat, I think.
Who was talking to you? Patricia, is it?
Patricia.
Hormone. Second?
Hygiene.
Okay, which is under bacterial. Okay.
And what you eat.
Okay, I can consider that's correct.